This conference is really about the interrelationship between spirituality and healing. There's not a lot of work done in that area, and so often we're afraid of the whole idea of the invisible. So what I like to do is focus on the invisible parts of our life and how that impacts our healing as people.
What have you seen in your experience?
Well, I've seen people grappling with a sense of meaning. I've seen people, when they come to the hospital, they go to the emergency room, get a sense of like being lost. And if they get bad news, there could be a great deal of anxiety. And so how does a person regroup internally, get a new sense of meaning and purpose to go forward?
How much do you see that need when you go to the hospital? Is that a prevalent thing among people, this need?
Well, I think what we've failed to do is basically, if you're a patient, we talk about numbers and things we can see. We look at the CAT scan, we look at the numbers from the blood tests. What we often fail to do is ask the person, how are you? What makes sense? How do you find meaning? So when you lose a leg, you lose an eye, you get a terminal diagnosis, those are the issues which are much deeper. And the research shows that people, first of all in their life, want purpose and meaning. Well, how do you find that? That's what in terms of spirituality. And then second, so research done in the States that's saying that, most people want their healthcare providers to talk about their spiritual life. Nobody ever does.
Does this apply to people who wouldn't necessarily categorize themselves as spiritual?
Most people will say that they're spiritual. They won't say they're religious. Then they'll say, I'm not Catholic or I'm not Jewish, but most human beings have a sense of something deeper and broader in their life. Only a handful of people I've met who said, I'm simply this body. It really depends on who's presenting. So it could be everything from people with mental illness and how they're often misunderstood. So there's a woman coming from Harvard who'll be talking about that. There'll be people from Portland, Oregon who'll be talking about homelessness and the search for meaning and purpose in their lives. We'll have people talk about how do you work with a multicultural group of people in terms of care and diagnosis. We'll be having physicians talk about how physicians grapple with meaning and purpose in their life. The keynote speakers are internationally known people who deal with spirituality, with healing. So it really depends. There's a wide variety. For instance, I'm going to do a workshop on the shadow side of caring. What's the dark side of caring? What happens to us? What stuff could come out of us, which is not always good as a caregiver?
And who should be participating?
Really, anybody who's patients, families, physicians, caregivers, nurses, educators, clergy, people who want to understand better the relationship between spirituality and healing. It's open to a wide variety of people. We have people from prisons coming, we have people from the government, people from nursing schools, medical schools, all across. And people coming from the United States as well as Canada.
This is something Providence has been doing for some time. Is it something that's replicated elsewhere?
No. I went to a conference somewhat like this at the Mayo Clinic, and every now and then they do have a conference on spirituality and healthcare. But when I moved here, I started this conference. So this will be our fourth conference. We have it every other year. And we have about 250 people show up.
Why do you think it's important to have it?
Because at the core of Providence is our commitment to caring for body, mind, and soul. And there's very little work being done on the care of the soul. We do an awful lot of work, research, and teaching on the body, but very little research on the care of the soul. I just read a paper that's going to come out. It's going to be talking about the spiritual needs of homeless people who are addicts and the religiosity of these folks and how that relates to addiction and mental illness. That'll be published in a couple of weeks. So we're beginning to do some research, but not an awful lot.